Hello. Once again, welcome to those of you who have joined us this morning. I'm Dr. Paula Berman, and I am a faculty member here at the Boston Graduate School of Psychoanalysis. Before I introduce our guest speaker, our main attraction this morning, for us it's the morning, I know people are dialing in from other places. I just want to go through a few logistics before we get started. First, I want to remind you that we will be recording the webinar and we are posting it online. By default, your video will be off, but if you choose to turn your video on, your video will be part of the recording. Your image will be represented in the recording. So if you don't want your image on the recording, please turn your video off or keep it off. By default, your microphone is off. Many of you might have some questions. If you want to ask a question, hover over the bottom part of the Zoom window and your microphone controls will appear on the right. However, if you don't want to speak your question, you can chat us a question while the presenter is speaking, and you can hover your mouse over the bottom part of the Zoom window and a chat option will appear and you can just type in your question that way. So I know many of you are interested in how to advance your careers, how to advance your education. There are a lot of questions. So without any more ado, I would like to introduce Dr. William Sharp. He is director of our Master's in Mental Health Counseling program. He's also on the faculty at the Boston Graduate School of Psychoanalysis, and he teaches psychology. He is on the faculty at Northeastern University as well. So,
very good.
Dr. Sharp.
Hi, and thanks to everyone who's joined us today. I'm going to go through a couple of slides. I really enjoy giving this presentation, which I'm calling What to Do with a Bachelor's in Psychology, because I find it can be really confusing to know the difference between graduate school options, but also just like, what can you do if you don't know what you want to do with your life in terms of careers in general? So this is a talk I've given a number of different times, and hopefully it'll be informative. And if there's time here towards the end, I can take some questions. But again, certainly if there's something pressing that you want to know, feel free to question in the chat. So let me jump into it so that we have time to get through this. So what do you do with a bachelor's in psychology? And here are some things that I'm hoping we'll get through. Kind of for those of you who are interested in mental health careers, which is obviously what I'm most interested in, talk about the difference between social work, counseling, psychology, psychiatry, compare a little bit about pay and training careers, explain the value of training and supervision. And then by the end, this is a short little webinar. You're not going to maybe know what to do, but hopefully give you some questions to start reflecting on and ways to think about how to begin the exploration of a path that might be right for you. So, okay. There is a huge overlap. When people do some kind of work in psychology, there's so many things that could be included. This particular image I use a lot to just show all the ways in which not just psychology, but psychoanalysis especially overlaps with everything from literature and fine arts and history, but to obviously also understanding our world in terms of organizations, in terms of social justice, in terms of government and how it works, in terms of also then the individual's mind and then how the individual mind intersects. So the point of this is just to kind of get you thinking that there's a lot of overlap, and with a degree, with a bachelor's in psychology, you can actually do, you have a lot of options open to you. So we're going to talk a little bit about some things. I do borrow this from another slide, another webinar that Dr. Berman does, just saying that there's going to be a really big need for mental health counseling. There's definitely more people seeking help. I think there are still a lot of people who, it's talking about mental health issues, going to see a therapist has some stigma attached to it, but I think that's lessening, and it's certainly lessening in some areas more than in others. But It's good to be able to talk. I really do believe talking helps. I think talking with friends and family is a good starting point, but sometimes you need a neutral person who really is going to put your best interest first. So there's a lot to be said about getting finding work in a career in counseling. So if you don't know if this is something that you're interested in, right? If you're thinking, well, maybe I want to go and work, do some kind of bachelor's in psych, and then end up working in human resources and people screen for jobs, help organizations find the right candidates for jobs. That's all great. That's wonderful. It's certainly something you can do with a bachelor's in psych. But what if you're thinking, maybe I want to work with people. Maybe I want to have a private practice. Maybe there's something that I want to do in the field of helping, but I'm not sure. The one thing that I really encourage people to do is take a gap year. You know, go out and do some volunteering. Go out and work in a residential program, in a group home, in a hospital, where you will be interacting with people, and you'll get a sense of like, oh, this is right for me, or this is something I don't want to do. And then both of those answers are answers to the question, do I want to work with people? And so either way it turns out, I think you'll be fine. Some people will find it difficult to see a job opening for somebody who doesn't have a master's, but what you want to look for very often in these places is what's called a milieu counselor. And that's basically a bachelor's level position, although some places you don't even need to have a bachelor's, where you're going to be in charge for like an 8 or a 12-hour shift of making sure people are at meetings that they're supposed to be at, that they're eating the meals that they're supposed to be eating, that they're taking their medication, that they're getting off to work if it's a group home, let's say, and they either have a job or they're going to school. You make sure that basically the day-to-day activities of daily living are happening for people. So you can get a lot of contact with quote unquote clients and patients, but basically people who need a little bit of help, maybe need a little bit of structuring. And so you really very quickly learn if this is what you want to do, if you want to have that level of interaction with people. Some people will say, how clinical is it if I'm just helping somebody, get out of bed and go get breakfast? It's extremely clinical. I'm often amazed. I do some supervisions and I work with some people who are on co-ops through Northeastern, actually working in places around Boston, Arbor Hospital, Italian Home for Children, etc. And they do a lot of running community meetings. They do a lot of one-on-one talking with clients and patients when they get upset. So it's actually way more clinical than you would think. So it's a really good starting point if you're not sure if this is the right career for you, if this is the direction that you want to go in. So volunteering or getting a paid job as a milieu counselor. There are some places that you want to look at hospitals, look at group homes, look at residential programs, day programs. Uh, and not always the best pay because you're, again, coming in with a bachelor's degree, but great exposure. Some places, so for example, the Boston Graduate School actually does have scholarship, a discount that you can get on your tuition places for a year. And so if grad school becomes something that you want to end up doing, knowing that you've done this work, even if you haven't made a lot of money in the job, it might actually help you long term when you're applying for grad school. So, okay. So then let's transition and talk a little bit about grad school. People, I find, even if you've done an entire bachelor's degree in psychology, don't exactly know um, in terms of like, do I need a master's? Do I need a doctorate? What should I be looking at? Psych, social work, counseling, psychoanalysis, where does all this fit together? So there's two things you need to know. Once you've got you can go for a master's degree. Um, if you're thinking private practice, social work and counseling are the two things that you want to do. Most psychology programs at the master's level, you're really not going to get a private practice. The only exception to that is school psychologists. School psychologists at the master's level do work. So for example, we're in Boston area. Many of the people in Boston public schools are master's level school psychologists, and you can work, you can do testing, you can write up evaluations, you run meetings with teachers and parents and students. It's a lot of interventions after the fact, so a lot of trying to help students be successful in a school setting. But beyond that, you're really not going to do much else with a master's in psychology. It's one of those grad programs that you really do need to go for the terminal degree, getting your doctorate. But social work and counseling is something that's an option. And one question I'll usually ask somebody who's consulting with me about what should I do career-wise, I'll say, where do you want to be in 4 or 5 years? And if they say something like, well, I might want to work in a clinic, but I really eventually want to have a private practice. I'll ask a follow-up question like, well, do you think you want to do testing? Do you think you want to one day maybe teach? If you answer, yes, I want to do testing, yes, I want to teach, you probably want to go on for the doctorate. But if you're really like, no, I just want to work with people, I want to work, 20, 25 hours doing therapy, or maybe a combination of therapy and some other kind of work, a master's is really all you're going to need to start and to do that. So for example, a master's in social work and master's in counseling, both get you licensed in the United States and various states. I will say for counseling in Massachusetts, we have the licensed mental health counselor. There are other states where you would become a licensed professional counselor, LPC. So it does have different names in different states, but here in Massachusetts, it's LMHC. You would bill insurance companies if that's the route that you want to go, or you would do private pay. Either one of those would work. At the doctoral level, the kind of already said, the psychologist is really the person who, if you want to open a private practice as a psychologist, you really need a doctorate. You would be able to do some testing. You would be able to write up test evaluations. I find those are the types of things people either want to do or don't want to do. And if you like it and it's something that you think you are interested in pursuing, definitely go for the doctorate in psychology. There are 2 general types. One is the traditional PhD. The other one is a PsyD, which is a doctorate in psychology, as opposed to a doctorate of philosophy. At the start, those 2 degrees really meant the PhD was more research oriented, usually more interested eventually in going to become a teacher at a university or a college. PsyDs traditionally were more for people who wanted to go out and do applied work, to actually see patients, have a private practice. So that's the history. Today, there's a lot more overlap. And for example, if you were a client or a patient walking into an office and you knew they were a psychologist and you talked to them, you would leave not knowing if they had a PhD or PsyD unless they had it on their wall or on their door, because in practice today, there's a lot of overlap. PsyDs do a lot more research and PhDs do a lot of applied work as well. But it is good to know that there are remnants of that particular training. You might find PhD programs a little more research rigorous and focused, and PsyDs a little bit more applied. For example, you go out very quickly and start working in the field. So those are differences between the 2, but in practice, at the end of the road, you're going to find that doctoral degrees in psych, PhDs or PsyDs, end up looking very similar. There is the PsyD, which is a doctorate in psychoanalysis. That is one of the degrees that the Boston Graduate School offers. It's the one that I have, Dr. Berman also has. These degrees are extremely applied. The research that we do in psychoanalysis is very often about understanding the human mind in a depth way that sometimes you don't get in other programs. We believe very firmly that there is an unconscious, and we take that as a starting point and really listen to what the client and the patient are saying to us and try to understand what's going on. It we do publish, we do research, but I think most people who get into psychoanalysis get into it because they want to learn how to really work with people. I'll use myself as an example. I actually came to this school already with a master's in school psychology because I was one of those people who thought I wanted to be a school psychologist and then very quickly realized I'm not interested in doing testing. I wanted to do more depth work and to actually, for example, meet with a patient every week and see if we can make progress. And that was not what I was going to end up doing as a school psychologist. Very few places offer ongoing work for school psychologists with one particular student. They're often, again, putting out fires, helping make the environment meet the students' needs in the best way possible. So it wasn't going to work for me. So that's where I ended up coming to BGSP and pursuing. I ended up getting both the master's in counseling so that I could be an LMHC in the state of Massachusetts and also the doctorate in psychoanalysis. The last doctoral degree I throw out there is in psychiatry. I do find that a lot of people really get interested in the term psychiatry. It conjures up images of working with people. It is a medical degree, so you're a medical doctor, an MD, and you do everything that every other obstetrician, podiatrist, every other kind of medical doctor does, and then you specialize specifically in psychiatry. Today, and we'll see this in some other slides, today, psychiatrists, just because of medical school and medical school debt, often end up working in clinics and hospitals and often are directors and do less face-to-face work with patients on an ongoing way beyond just medication. So you might have an initial meeting with a psychiatrist for an hour, but then for the most part, you're doing monthly 15-minute meetings. And the psychiatrist is mostly asking whether or not you feel better if the symptoms have been reduced, and if not, they tweak the medication. So psychiatry in terms of ongoing mental health, unless you're really far along in your career, you've paid off your student debts and you can afford to set up a practice on your own, you're probably not going to initially be doing a lot of therapy. Some people still want the medical doctor, they want to have that background, so it's an option, but realize you probably wouldn't start a private practice if that's your ultimate goal until way later in your life and in your career. So I want to talk a little bit about just comparing some of the pay and trainings that each one of these careers may have. Some of this information is obviously continues to be updated. Where I could, I included a link just so you could get information. But one of the things you'll see here, going back to my comments about like what can you do with a bachelor's in psych, there are a lot of works and names, and you can see here both careers with an associate's degree, but as well as with a bachelor's degree, and they run the gamut from $38,000 down to $105,000, really depending on which direction you go on. This is not a webinar on why we pay people who do things like health education and social work so much less than we do people who do sales managers, but it is says something about the culture in which we're all living in. But I will say, it's not great pay if you're doing the being a helper side of things. So health educators, social work tend to be on the lower end of the scale with just the bachelor's. Most bachelor's degrees are 4 years. That people probably already know. Some are 5 if you've done some co-ops and some field work as part of it. But it's a start, and it's something that I find, again, really helpful for people. If you were to get then into the master's level, in general, most master's programs are 2 or 3 years, and most require about 2 years of work after you get your master's degree if you're interested in getting a license. So again, for those of you who are looking for the easiest way to get a private practice, this is what you would do. 2 years in education, in a school, in a graduate program, doing both learning as well as applying your skills as a counselor or social worker, and then 2 years out working somewhere in a clinic, in a hospital setting, where you are getting paid, but you're actually working under someone else's license until you have your own at the end. So most of these would be, think of it as a 4-year thing, 2 years in school, 2 years working, and then you'd be ready to set up a private practice. You can bill insurance with the degree in counseling or the degree in social work. Historically, counseling comes from schools, so you learn a lot of skills. You learn a lot of how to understand individuals. Social work traditionally comes out of places like Hull House, more of a social service tradition. Again, similar to what we were talking about before with PhDs and PsyDs, there's actually a lot of overlap between the two. You could walk into someone's office where they just have their name on the door and spend an hour with them and leave not knowing if they were a social worker or a counselor, today, just because they function so similarly in the consulting room. Unless they were to tell you, or unless you saw their degree, you might not know that they were a social worker or a counselor. In the training, though, you will see a difference. Social workers end up doing a lot more understanding of systems. I think counselors end up doing a lot of work, usually more skills and more focused in on people. So these two sides, I'm just going to flip back. The counseling and the social work look very similar because they really are very similar. Summarize that: 2 years working in school and then 2 years working after under some. Obviously, there's a pay bump once you finish your 2 years postgraduate. Then you can work on your own, and obviously not having working in a clinic or a hospital who quote unquote is taking money that you're earning from the insurance company. You would make more money doing all that and eliminating the middle person. So just throwing that out there. Okay, moving on to the PhD PsyD programs. Just to compare them to the master's programs that we just talked about, you can you do some programs in 4 years. I find for the doctoral, some people take more like 5 years because they finish all their coursework and then focus on writing their doctoral, which really separates the master's and the doctoral. After you finish school, there's still 1 more year that you need to do. This is working full-time where you are getting paid, but you're under someone else's license. So very similar to what we were just talking about with counseling. You would need to think about working 1 year in a clinic, a hospital setting, under somebody who already has their license. You can, at that point, have a private practice, bill insurance, etc. Historically, this was also the way that people got into helping professions without a medical degree. So the PhD was kind of the first clinical psychologist to start working besides the psychiatrist, and then it became the PsyD, and then the social workers, the counselors have all kind of gotten into it. I will say, just to connect this back to psychoanalysis, since I'm talking while in a school of psychoanalysis, really Freud was the first person to start working with people on that deeper level. A lot of the medical approach to working with people would be if somebody was really hysterical, had symptoms that the medical profession couldn't explain, didn't seem to make medical sense with the knowledge of the time, they might get wheeled into an auditorium, put in front of a bunch of other doctors, and talked about while they were on stage. Freud was really the first person to say, maybe that's not the healthiest way to treat people. Maybe we should make them more comfortable. He kind of inaugurates this idea of like, what if we had them in a room and it was just you and that particular patient? What if they were in on a couch where they were lying down and a little more relaxed and not being observed by a bunch of other doctors? So really Freud inaugurates a lot of these changes in the way people get treated. So psychoanalysis starts it, and it's still around today, 140 years after Freud really started writing and thinking about the unconscious and how to work with people in a deeper, more understanding way, and not a traditional medical model. So just a little plug in there for psychoanalysis. Other doctorates: psychiatry, again, 4 years medical school, kind of like we said, same in med school with everybody else who's family practice, interested in psychology, whatever their specialization becomes. You're with them until you start specializing in psychiatry. You obviously can have a private practice and bill insurance, but it's usually less done because the insurance companies pay a lot more money for psychiatrists to actually do medical evaluations, prescription evaluations. There's a link on this particular slide, and for some reason, if it's not accessible, if you just Google New York Times psychiatry's identity crisis, you'll find the you'll find a discussion of what I was saying about before, where really psychiatry, which was the seat of mental health work and help, really today is much more about prescriptions and following up and making sure prescriptions are still working. So there's a real kind of, it's sometimes people conjure up images of doing a lot of counseling, movies and television sometimes adds to that, but in reality, there are way fewer psychiatrists, certainly hardly any in the beginning of a career, doing weekly ongoing therapy with any one particular patient. Okay, so maybe you've got some ideas now about which direction you want to go in. You can begin to think about, do I want the master's level because I'm just interested in private practice, or do I want to do testing and maybe I want to do a doctorate in psychology? Here are some things to start thinking about how to select. Um, um, I'm going to just say, in summary, you want good training and good supervision. If you're going to set up a private practice and you want to be successful, you really need to have success with your patients. They need to feel helped and listened to and understood. They need to tell their friends. You know, I've been really fortunate in that I've not really run very many advertisements. I get most of my referrals from word of mouth because people know I'm good at what I do. I've also been lucky in that I've gotten experience both doing individual therapy, group therapy, and family therapy. I've learned the basic skills of how to explore with people, which I attribute all to the Boston Graduate School of Psychoanalysis. So I had a master's, as I said, coming in, but I don't think I would have had any clue how to do a private practice had I not come here and really thought about it. So you really want to make sure you get good quality training. So the first thing you might want to consider is where you're planning on living and setting up a practice. Although there are a lot of similarity in programs between different states. There are some states that actually, there are a lot of people who are interested in being therapists and counselors. And so they are, there's a great supply. So the requirements, the bar to become a counselor or a therapist can be set relatively high. Most in New England, certainly Massachusetts, along the eastern seaboard, and then in California, you know, the requirements are pretty high. Places where there's a shortage of therapists, sometimes the regulations are a little bit lower. So, you know, not picking on any one state in particular, but for instance, if you wanted to be a therapist in South Dakota, the requirements are probably going to be a little bit lower than they might be in Massachusetts. But you want to know where you want to be, because when you're setting up your practice, you want to get licensed in that state. Most colleges and universities who are in a state kind of teach to what they know the state requirements are. So I'll use BGSP, the Boston Graduate School, as an example. You know, I'm the director of the Master's in Mental Health Counseling program. When we're doing any kind of curriculum changes, we usually start with, okay, well, what does the state require? Okay, they have these 10 areas that we're supposed to cover. We make sure that students get those 10 courses. So you're going to find that from program to program in any one given state, there's going to be a lot of similarity, because again, they're all teaching to what that particular state wants. If you get licensed in the state of Massachusetts, you can probably find reciprocal licensing in a lot of other states. The reverse might not be true. If you were to go to a state which has a lower regulation and then you move, you may end up having to do some more supervision, some more field work, or even take some other classes in order to get the license in that particular state. If you're not sure, you know, you could look at a couple of states that you might see yourself living in, and see if there's any one particular class that that state requires that another state doesn't. And then as an elective, try to pick up that course as part of your master's or doctoral program. But again, talking about BGSP, if you come here and you want to get licensed in Massachusetts, you will be fine. If you want to take it somewhere else, you just want to check that that state's got similar requirements and regulations as to our state. One thing to ask somebody in admissions is about what their graduates are doing. So for example, if you want to have a private practice and you're talking to the admissions person and nobody seems to have a private practice, but they're working in a lot of other interesting jobs, but not what you're interested in, maybe that's not the right school for you. To the contrary, if you go and they say, oh yeah, a lot of our graduates are in private practice doing well, and that's what you want to do, then you're probably another check in the plus column for that particular school. One thing that, again, going back to my initial statement about the importance of knowing what you're doing, quality supervision and quality training, ask about supervisions. If it's a minimal amount of supervision that the state's requiring and the school is offering, that's a good start. But if there's an emphasis on supervision, if there's an emphasis, and if you read faculty bios and they all seem to be, again, doing what you want to do, so they're in private practice, they're working with people on a one-to-one basis or in groups and family therapy, then that's probably the right place for you. If you are interested in being a researcher and teaching at a prestigious university, then all the faculty working in private practice might not be the right connection for you. So you do want to spend a little bit of time thinking about what you want to do, and then look at the faculty and see if it matches up with your career paths. If you don't know what your thing is, then going back to what we started with, think about being an intern, volunteering, or even working. I find that even if you don't like the job, that's good information to know. Right? If you start working with, let's say you're working in a nursing home with a geriatric population and you end up not liking it, good thing to know. Maybe you want to work with children. Maybe you want to work with a college age population. Maybe you just want to work with middle adulthood patients. Like it's really good to know. So try different things. Warm lines, crisis hotlines sometimes give you exposure to different degrees of symptoms or different types of patients. Also, you may not know that you want to work with a geriatric population because you've never worked with them, and all of a sudden you're working in a nursing home volunteering, and you find that you have a knack for it. You find that you're just naturally really good at it. So there's a lot that you can really get from interning and volunteering. You may get different types of supervisors, which I think can be really helpful, because certainly mental health, helping people, is not a one-off, get your degree and leave. It's something where you're going to stay in supervision. You're probably going to stay doing some postgraduate training just to keep yourself fresh, just to keep things in your mind. It can be a little isolating if you're working in private practice. So, being connected with professional organizations can be really helpful. Working and volunteering on crisis hotlines, warm lines, which is another term for, it's not necessarily a crisis hotline, but people who just might need a little bit of an empathic ear. And also, don't forget, for many of you, and I don't know your ages, but if you're on the younger side, you can end up doing one thing, and then probably in your work life, you'll be able to change and have another population to work with, or work in a different way later on. I often think, people are like, but I need to know what I'm going to do right now. I want to make sure I'm doing the right graduate training. I want to do the right program. And I want to do it in 2 years. I don't want to do it in 3 years. Think of it this way: 50 years from now, when you might be retiring, whether you worked for 49 years, 50 years, or 51 years probably isn't going to be that big of a deal to you. It feels like a lot at the start, that I want to get through and do this as quickly as I can. But in the long run, I don't think that matters. So do what's right. Do spend the time now investing in a career. A couple of things, figure out how you think we change. Like, how do you believe people actually change? So thinking about your theories of personality, reading different books, topics, theories of change, Attending conferences is really helpful. If you happen to be a current student somewhere, conferences usually take volunteers where you can do a little bit of work and go to the conference for free or at a reduced price. Also, some conferences have student rates, which are often 75% less than a full member or conference attendee. There are a lot of email listservs, podcasts, etc. I list two here to links. The Psychotherapy Action Network, or CYAN, is a really good one to join. It's actually free right now to join their listserv. And there are some people having really interesting conversations about the future of talk therapy. And then there's also good podcast shows that give you an idea about what it might be like to be a therapist in a therapy session. So one that I've been recommending to people is Esther Perel's Where Should We Begin? And that is Perel is an amazing therapist who gets very quickly to people understanding people's issues and asking the right questions, I think, to open them up to what are their options and how do they envision things happening. And she often does a lot of relational work with couples. However, she does do some consulting with organizations. So it's got a nice kind of going back to that idea that psychology, psychoanalysis hit so many different areas and overlap in so many different things. Her podcast is a really good one to listen to. And again, free wherever you get. Ultimately, though, the choice is going to have to be you. You may have parents and friends and partners who are pushing you in one direction or another. You're living this life, so you're going to have to spend some time reflecting on what's important to you. Like I said, it's a long career path if you're young. So 1 or 2 years doing a gap year, adding a year onto a graduate program just so your depth of your training and your supervision is better isn't going to matter at your 50-year retirement. And for many people, I think, people are going to be living longer. So you might have multiple careers, be working in multiple different settings. So don't worry about it. And I know I have a lot of people who say, but I need to do this cheaply and I need to do it quickly. You can't always choose for money. And I know sitting on the other side of things, it makes it seem like it's easy for me to say, but I'm really, whatever I can do to help you say, if you're meant to be a counselor and it means you have to take some loans, then you have to take some loans. And if that's where you're meant to be, if you try to do something else, like you say, well, I'm going to go into business because I want to be that sales manager because I want to make the triple 6-digit figures, you're going to end up in a midlife crisis at some point and having to come back to what it is that your real calling was. So really spend some time thinking about your convictions and your beliefs and where you want to go and what you want to do. So you really do have to, you're the one who has to live with this choice, not your friends, partners, and parents or family members. So spend a little bit of time really thinking about that. That is pretty much everything that I wanted to get out to you. I will say, if you want to follow me, my Twitter handle is at Dr. William Sharp. I read a lot of things. Often is very much what I'm reading, but sometimes that's helpful for people to just see different approaches. I'm obviously a psychoanalyst. I believe really in that things have meaning and that people have been in traumatic situations or grown up with issues or are struggling. It's probably going to take some time to get out of those habits. So I take a very longer term outlook to change. But I tweet about a lot of different things. So certainly feel free to follow me. And if you want to send me a direct message and tell me that you heard this webinar, that would be great. But I do think we have time if there are any questions. People can either type a question in, or if they want to unmute their microphone, they can ask a question. So let me just open it up and we'll see where it goes.
Thank you, Dr. Sharp. I think you did a very thorough job covering a very complex set of options that people are facing right now. I can, as the Boston Graduate School of Psychoanalysis Director of Admissions, go over a few things about the school. I think there are a few, here are some other links that Dr. Sharp didn't cover, but might want to just mention.
I'll just mention, I threw these on at the end in case anybody wants to get up-to-date information about careers and job potentials, earnings from more current links.
We did just get a question, Dr. Sharp.
Oh, okay. In order to become a counselor, one of the requirements is to work under someone with a license. What type of license would fit in that situation? So that's a really good question because it can be really complicated. But basically, think of it this way. If you're a psychologist, they really want you to be supervised by a psychologist. If you are a social worker, they want you to be supervised by a social worker. If you're a counselor, they want you to be supervised by a counselor. However, counselors are a little bit more flexible right now. Of your 240 hours that you need, only 75 need to be from a mental health counselor. So you can actually get, for counseling, specifically in Massachusetts, you can actually have a social worker, a psychologist, a psychiatrist, as long as you do somewhere in your pre and post training get the 75 hours from a licensed mental health counselor who's been licensed for at least 5 years. This is one of those things where it's really good to know the state that you're talking about, because that varies by state and location. But that's true at the moment in Massachusetts. Thanks for the question.
Okay, so if there are other questions, you can feel free to type them in. But meanwhile, I'll just spend just a few minutes talking a little bit about the Boston Graduate School of Psychoanalysis and what sets us apart. I know that Dr. Sharp went into a little bit about psychoanalysis and how it, in fact, is working with people at a very deep level. So our master's degree in particular, our master's in mental health counseling degree, offers a very practical degree. It's a license eligible degree, and simultaneous to getting this practical degree, you're learning how to work very deeply with people. So that's one way that sets us apart. Although we have the Master's in Mental Health Counseling program and we teach to the state license requirements, we infuse those requirements with a psychodynamic approach. We are the only school in Massachusetts who does that. We're one of the few schools in the country that does that. I know also Dr. Sharp mentioned when choosing a program, you really want to look very carefully at the clinical training and the supervisory hours that the program is providing for you in your studies. And I think you will find, I can confidently say this, that the Boston Graduate School of Psychoanalysis is probably going to give you more clinical training and more supervisory hours than any other program in comparison. I won't get into the details of how we do that and how much we exceed other programs, but if you go on our website, we have a chart that clearly differentiates us from the other programs, particularly in this area, because we actually excel at it. That's kind of the core of our existence. And the third way that we're unique is that we really, really believe that understanding your own emotional dynamics is key to success as a counselor, as a psychoanalyst. And as a requirement, we actually have a personal analysis in the mix of your academic studies. And it's an opportunity for you to understand your own nature and how you get impacted by your patients, and also to understand what it's like to be on the other side of the equation as you're working with people. We are, once again, one of the only practices that require you kind of walk the walk and talk the talk. And that's another way that we're unique. I think we just had another question. Would working in OTP programs count for working experience for becoming a licensed counselor?
That is a great question. I actually don't know the answer to that one. I think it would probably depend on who you're being supervised by and the specific type of work that you're doing, that's the type of question that I would, in the state of Massachusetts, I would refer you to the Board of Allied Mental Health. You could start with their website that lists the requirements for all of the different licenses in the state of Massachusetts. That's the board that's really in charge of making sure people meet the requirements. I do find that unless you are a lawyer, reading through all of the different codes can be cumbersome and feel like a lot. And so it might be helpful to actually call them and see if you can talk to a live person. Sometimes that's a little bit easier to get through. The other thing to do, though, is to see if there's a professional organization. So in the state of Massachusetts, for instance, we have the Massachusetts Mental Health Counselors Association. They're extremely helpful as a professional organization in answering these types of questions. So there might be something similar for OTP. I'm not 100% sure, but certainly start with the state. A Google search would tell you in your particular state what the requirements would be. But in Massachusetts, I know it's the Board of Allied Mental Health. You could read through the regulations, but then if you're really stuck, call them or try to see if there's organizations, again, professional organizations that help.
Do any of you have any questions specific to the school or any of our degree programs? I'd be happy to answer any of those. And if you don't have them now and you have them later, please feel free to contact me. My phone number is on the slide, as well as my email address, and I'd be happy to help you find some answers should you have some questions.
Well, this was great. Thank you for asking me to do this. I hope people found this helpful, and I hope people follow up if questions occur to you later.
Yes, I say the same. Thank you very much for your time, and we hope to hear from you. Thank you very much. Bye-bye.